Hey everybody, hello. Join me for a mini hand treatment today, seated on your mat if you can. This is Denise here and happy to melt with you today. We'll need your large softball and that's it. If you're uncomfortable, of course, you can always stand or sit on a chair if that feels best for you. I always like to maybe take a roller, half roller, and just wedge it behind my seat, and that shifts my body weight forward so I'm not feeling any strain in my back. So if that works for you, maybe give it a try. And let's get started assessing if we have some stuck stress in our body today. So with your grip assess, let's start to squeeze the ball a couple times left to right and notice if you feel like your grip is stronger from one side than the other. Notice if you feel any tension going down the forearms when you grip that ball. Or perhaps do you feel any tension in your knuckles, or you can't sense your fingertips. It's hard to curl your fingertips over the ball. So all of those are signs of stuck stress. Remember, the grip assesses, when you grip the ball, it's a neurological signal to the brain. So we're really assessing sensory motor control and if it's impaired by stuck stress in our body. All right, so remember what you feel and let's get into your glide. So gliding starts at the base of the hand. I'm just going to turn myself here so you can see. I'm doing one hand at a time today. If you like, do 2 times at a time, but we start at the base of the hand, right at position point 4. Just bring the ball to the base of the hand. Your fingertips will be down on the floor. Keep them there. Other hand comes on top. Give a gentle push to the ball and then start to move your hand from side to side. So we're just creating a little motion. I've got my right hand moving my left hand a little side to side. Nice consistent pressure. And taking a couple of focus breaths in. So gliding prepares the tissue for the shear. Okay. Nice consistent pressure. And then we'll do the other side. So finding the ball at the base again, right there, position point 4, fingertips down, other hand on top, give it a gentle push and start to move a little right, a little left. Now check, are your fingertips up like this? Because you'll see that a lot. A lot of times people are trying to glide with their fingertips up and that just puts tension in the forearms. Are your shoulders relaxed? Check in with the rest of the body just to make sure that we're not accruing stress somewhere else because we're treating our hands. All right, now we're going to hold that ball at your thumb pad. So at position point 3, okay, the thumb pad is where we shear. I'm going to use my other hand to create small circular motion to start, and it's a kneading motion. I'm going to use my body weight to just kind of shift forward a little bit, so I'm not working so much from my arms. And then that's your direct shear. Your indirect shear is when we pause, the ball's not moving, and you can move your thumb around in different directions to create a fluid exchange from coming from the deeper layers of our connective tissue to the more superficial, so bones to the skin, whereas the direct is skin to the bone. And then wait here for a second, take a breath in. Okay, decompress, other hand. So right to that thumb pad, other hand comes on top. Remember, you're just creating a push so that you feel the pressure, but you don't want to feel pain. So again, that's a sign to ease off pressure, create your motion. So I'm going to take my top hand away so you can see that kneading motion here. You can push in one direction, you can push in the other direction, you can create circles for your direct shear, and then the indirect shear is just letting that thumb move around with the ball staying still and the pressure staying constant. Take a focused breath and then wait, let it go, decompress. All right, so now we've got these pools of fluid in our hand. What are we going to do with it? We're going to rinse. So finger rinse here, spread the fingertips just like that. Okay, and you'll take your ball, and let's start off slow here. We'll take the ball to the knuckle and then roll it over the fingertip off until you get underneath the wrist pad of the hand that is navigating the ball, and then restart. So slow roll. Sometimes I feel, I see a lot of folks just kind of doing this, right? But if you can get the benefits of continuing that direction, that mechanical pressure to push the fluid in the direction that we want to treat our connective tissue and our joints, well then, why not, right? So make sure you get the thumb. You can go over the tops of the fingertips. You can go in between the fingertips. I usually do in between the fingertips on my second pass. Sometimes I do a third pass. And then let's do the other hand. So spread the fingertips. Again, start with the ball at the knuckle. Then light pressure as you glide. Make sure you get underneath the wrist pad. Yep. Bring the hand a little closer to you, especially if you're seated, so you're not pulling on your low back, especially if you tend to be tight there. Check in with your body as you're performing this seated. Right, you might need to do a little melting on the upper back, or maybe you need to do this at a table if you're feeling any strain in the body. So over the tops, second pass is in between. Okay. And you can even get outside that thumb just like that. Okay, going from the tip. All right, from here we go into your friction. So just take that ball and light vibrational motion between the hands. We're just creating a little bit of the interstitial fluids, whatever was left over, we're going to send that over to your lymphatic system for recycling. That happens sometimes from rinsing. It also brings blood flow to the tissues. And overall, it just puts me in a better mood. Okay, and now turn your palms up. Do you sense that buzzy sensation? I always love just bringing awareness to that, especially if you feel it up the forearms, because that's the fluid exchange. That is what you're creating by melting your hands and rinsing. All right, let's go back to our grip assess. Squeeze the ball a couple of times. Notice, is your grip more evened out? Yes. More efficient, less muscling through. I always feel less muscling through. Do you feel less tension in your knuckles if you had knuckle tension, or do you feel like you can curl your fingertips over the ball more? And what about the forearms? I'm definitely sensing less tension. How about you? All right. Well done today. Thank you so much for joining me. I hope you can value these changes in treating the upper body and the neck and the shoulders with a mini hand treatment today. I'll see you all soon. Keep it up. You're doing great. And happy melting, y'all.